actually to respond to a lot of inquiries and questions from the expat community about our vaccination plan for foreign residents living in Thailand. We do understand and hear you very, very clearly. So we'd like to, it's quite understandable why there are lots of questions surrounding this, but allow me just to give you a few clarifications. And I'd also like to say that the Department of Disease Control had already given a press statement about this as well in the Thai language. So we've been working together very closely to set up a plan. We'd like to confirm that Thailand's vaccination strategy is based on ensuring accessibility to all those who require it, regardless of their nationality. Comments on this regard have been taken out of context in the media. We know that. So we'd like to reiterate that Thailand continues to include foreign residents in its vaccination program, and foreign residents have been inoculated in the first phase already. But due to the limited number of vaccines we had procured in the beginning of our vaccine rollout, we had to prioritize in order to prevent death and protect those who are most vulnerable to contracting the COVID-19, to protect our health systems as well. And therefore, vaccinations in the first phase prioritize medical personnel, frontline workers, the elderly, and those with serious underlying diseases, as well as those living within the high-risk zones, such as border areas. The first phase has already commenced, and it started at the end of February, and it's still ongoing until the end of May. Foreign residents in this particular risk group, have already been inoculated in this phase, such as migrant workers and migrant health volunteers. Now that Thailand has been successful in procuring more vaccines in the second phase of inoculation, which is going to start in June and will run until the end of this year, we have expanded within this phase, the second phase, vaccine coverage to include the general public and people working for the public sector, including the diplomatic community and international organizations, as well as foreign residents in Thailand based on their membership in the risk groups. Now, lots of questions about the MOPROM mobile application system. We know that the MOPROM system currently does not accommodate registration for foreign residents for vaccination. But this will commence, the registration, which will commence in June. And therefore, the Ministry of Public Health is now working on the best method, including through a possible mobile application or contacting hospitals directly to facilitate registration for foreign residents as soon as possible. We're constantly working on improving all platforms and means for registration to ensure ease of access and function. So please do continue to give us responses and comments about how these platforms work or do not work. We will all take this on board. And efforts are also being made to avail of private sector vaccines, using vaccines purchased by the public sector. And this is because vaccine producers usually will not sell vaccines directly to the private sector, but rather only through governments. And therefore, public entities such as the government's pharmaceutical organization or the GPO can act on behalf of the private sector as among one of the options. So if this is successful, vaccines will also be made available for purchase during the second phase. More information for this option will be shared as soon as possible and as the private sector secures their vaccination procurement, and we will help distribute this information as soon as possible too. And therefore, we ask for your patience and understanding and appreciate your comments as well as questions which we have taken on board. These will help us improve the work to ensure that all the people currently living in Thailand are safe from COVID-19. Before I end our briefing today, allow me a few minutes of your attention to bring you to this particular slide from the World Health Organization. As a reminder, this infographic today is extremely important, as although we're facing challenges of COVID-19, we still must take good care of ourselves and of our health and try our best to keep up with our medical appointments. Remember